In today's video, we are going to be looking at a condition medically known as Nuchal cord. But simply put, it is that condition in pregnancy where the cord wraps around baby's neck. This condition can cause a lot of concerns for pregnant moms or moms-to-be. However, the essence of this video is not to cause any form of anxiety or to scare anyone. It is to provide evidence-based information to reassure and to educate. Hello and welcome once again aboard JulieCity. As usual, I'm always so excited to be here and I'm glad you are here. Thank you for clicking to watch today's video. You're highly appreciated. Now make yourself comfortable. Let's get started. We are continuing with our pregnancy care series, and today we are going to be looking at what is medically known as Nuchal cord. But I don't like to bore you with medical terminologies, so it is that condition that the cord wraps around baby's neck during pregnancy, and we're going to be looking at how, why, management, and reassurance. According to research, up to 30% of pregnancies experience this condition, and it is caused by the movement of the baby in the womb. So we know that as pregnancy continues to grow, movements begin to happen. Baby begins to make movements in the womb as part of their growing and developing process in pregnancy. And as a result of this movement, sometimes it can cause baby to get entangled with this cord, particularly around the neck. This condition is way more common, but it causes a lot of concerns for pregnant moms or moms-to-be. Like I said, up to 30% of babies end up getting entangled, particularly around their neck, with their umbilical cord. And I want you to know that the first toy a baby gets is actually their umbilical cord. Yeah. Did you know about that? Let me hear from you in the comments section. So yeah, the baby starts learning how to play with the cord. Another reason could be as a result of increased amniotic fluid. I have made that video before, so you can check it out to get full details on the amniotic fluid and different conditions that can happen with the amniotic fluids. So if there is so much amniotic fluid, that water that surrounds the baby, if there is a lot of it in the womb, known as polyhydramnios, this can give baby lots and lots of room to move and swim around. Just like a bigger pool leads to flexible swimming, isn't it? You have more room to swim around. A smaller pool kind of restricts. So when the fluid is larger, known as polyhydramnios, baby has more chance to roll, wriggle again, and this might lead to Nuchal cord, or the cord wrapping around baby's neck. Another reason, according to research, could be the length of the cord. As we are all different, everyone is different, every pregnancy is different, every baby is different, so is the length of the umbilical cord. Now, a longer umbilical cord might lead to baby getting entangled or getting the cord wrapped around baby's neck while it is moving. Now, you cannot do anything about it. These are some of the things that are outside of any woman's or any person's control. But I will always say in my video, if you have any concerns, then speak to your midwife or doctor looking after you in pregnancy. Also, ensure that you attend your antenatal appointments. Take them seriously, take them religiously, so that if there's anything that will cause concern, it will be spotted on time and a management plan will be put in place with you at the center of it to make sure that it doesn't escalate, and even when it does, that you'll be properly monitored and given the best possible care. Again, I want to reassure you that it is not dangerous. The obstetrician, that is doctors that are trained to look after pregnant moms, and midwives that look after you during pregnancy and at birth, are trained to manage cord wrapping around baby's neck. So it's not as dangerous, and like I said, it happens up to 30% of the time. And even when it turns out that the cord is tighter than usual, they also have the technical know-how to manage this condition. So breathe in and out. Let's continue. The next big question will be, how do you diagnose or detect cord wrapping around baby's neck? And one way is by ultrasound. So during one of your antenatal appointments, ultrasound, this can be identified. Like I said, I don't want to scare you, and I want to reassure you that you don't need to go for extra ultrasound just to check if the cord is wrapped around baby's neck. It's not necessary, but keep your appointments, your already scheduled antenatal appointments. And in any of the scan, if it is detected and it's something that needs mentioning to you, the doctors are well trained to inform, guide you, and manage accordingly. So there's no need to pay extra money just to check if the cord is wrapped around your baby's neck. It's not necessary. Most of the times, cord wrapped around baby's neck is only detected most times at birth. And be reassured that your midwife or doctor looking after you at birth is well experienced to conduct the relevant intervention or maneuver to sort out this situation. But at every step of the way, you will be duly informed. So again, take a deep breath in through your nose and gradually blow out through your mouth. Relax. Okay, let's continue. I will just reiterate again. Knuckle cord, or what we commonly know as the cord wrapping around baby's neck, is very common. Up to 30% of pregnancies go through it. It is so very concerning for a pregnant mom to hear that the cord is wrapped around their baby's neck. But I'm also reassuring you that it is not dangerous. It's also important for you to know that your midwife and your doctor trained to look after you in pregnancy are well informed and educated or skilled to carry out any relevant maneuver or intervention in order to unwrap that cord during baby's birth. A few times, this condition is detected by ultrasound. However, it is not necessary to pay extra money for another ultrasound just to determine if the cord is wrapped around your baby's neck. Be rest assured that your medical practitioners that are looking after you in pregnancy and birth will take care of it with you duly informed. However, it is important that you discuss every concerns you have with your midwife or doctor looking after you in pregnancy, because one thing we don't want for you during pregnancy is for you to worry. Worry or stress is contrary to pregnancy, the developing of your baby, and even your body coping with this whole changes that is happening. We don't want you to be stressed at all. So if you're concerned, make sure you speak out. Speak to your midwife, speak to your doctor looking after you in pregnancy for relevant reassurance or a specific plan or line of treatment specific to you, because everyone's case is different. When you relay your concerns, your own specific needs will be taken into account to give you the best care possible in order to keep you and your unborn baby safe. I hope you found this video useful. If you have, if you've not liked, then like this video. Leave me a comment. You can share your own experience, testimonies, fears and concerns, so we can all learn from your experience. Subscribe if you have not, and share this video to others who would need to see it. Till I see you next time, don't forget, your health is your wealth. Remember to click on these videos that are popping up. I'm sure you'll find them insightful. Bye-bye. Remember to share all your concerns with your midwife or doctor that is trained to look after you in pregnancy, because that is why they are there, to reassure you and provide relevant information for you to make this best decision for you and your baby, and to have the positive pregnancy and birth experience.